Communication is an essential part of life. When someone has a difficulty communicating, it can affect their ability to interact with others. Speech pathologists help improve quality of life through better communication.
There are many roles of a speech pathologist. We work with children and adults who have communication or swallowing problems. So the communication problems might be difficulty with their voice, fluency, or just getting their message across and communicating because of a hearing impairment, intellectual impairment. They might have not developed their language, or they may have encountered a disease during their lifetime or have had an accident that stopped them from performing their normal way. There are many different places a speech pathologist can work. Some particular settings may be in the hospital, in both acute and rehabilitation phases of a person's treatment. You can also work in community health, in the education sector or disability services, and private practice. My workday consists of coming to work, checking what patients need to be seen by speech pathology services that day, going up to the wards, seeing my patients for either assessment or treatment of their problems, and then I will spend an hour or two in the afternoon either doing project work to develop resources, or I might spend my time doing paperwork. I think speech pathology is a really good profession to be involved in. You get to work not only as a single clinician, but as a part of a treatment team within your own discipline and other disciplines, which gives you a great deal of knowledge that you can keep building on throughout your experience. Also, you get to be with people every day. It's nice to know that at the end, after all your hard work and their hard work, that they can regain full functionality in the community. To become a speech pathologist, you have two options of study. You can come into the department as an undergraduate student straight from high school. So you want to work towards getting a good OP. And then once you do get accepted, it's 4 years of study, which involves clinical experience that'll get you towards becoming a speech pathologist. Alternatively, you can do another undergraduate degree and then enter into speech pathology through the Masters program, which is a postgraduate study program that runs for 6 semesters for 2 full years. And through that, you get both your educational and your clinical experience at the same time. You really need to have a love of people, a love of communication. You need to be able to put yourself out there, not be afraid of looking silly sometimes. You have to be able to work well in a team and really be able to problem solve. I think one of the best things about studying speech pathology at UQ is the amount of experience that you gain whilst in the field, whilst doing your degree. From the word go, when you do start, you get clinical experience, whether it be observing what a clinician may be doing or actually treating those patients. During my time at UQ, I found it to be a very supportive environment. The faculty were always available to answer our questions, answer any concerns, and really help us learn.
I love studying at UQ because the courses here are great. The lecturers are really good because then you can find out about the subjects, and if you're unsure of anything, then you can always ask and they're happy to help.
UQ's Bachelor of Speech Pathology provides a career with the opportunity to assist people and even change lives through better communication. To find out more about studying health at UQ, visit UQ's study website, uq.edu.au/study, and click on Health.